Okay, so it looks like we are live on YouTube. Good morning, everyone. I'm Francisca Blanc, Advocacy and Outreach Coordinator with Utah Housing Coalition. Thank you for joining us for the November monthly meeting. And we have two different topics today with two different speakers. First, we're going to hear from Mike Akerlow, who's the Executive Director of Community Development Corporation of Utah, CDC Utah, who also sits on the, is a member of the Utah Commission on Housing Affordability, and he's a very active participant in the Salt Lake Valley Coalition for the Homeless. And my apologies if I got that wrong. So Mike, we're going to do his presentation, and at 11:30, the second speaker will going to join us. Her name is Katie Prawitt, and she is with Unite Us. And Mike, you have our attention.
Great. Thank you so much. Thanks for letting me be here, and it's good to see a bunch of familiar names on the participant list. As Francesca was saying, I have participated on I was on the original steering committee for the Salt Lake Valley Coalition to End Homelessness. I was the housing co-chair along with Zach Bell from Housing Connect. And my term ended in April of 2021. However, I still remain active in that. And part of what I'm showing, or part of the reason we created this new initiative was a result of the time that I spent on the steering committee, and in particular working with Zach on housing issues around homelessness. And when Zach and I first were put on the steering committee, we talked about how do we really approach this in a way that is digestible, that people can understand the need, that we can take to policy makers and funders and really show them what's going on in Salt Lake County regarding housing and homelessness. And so we created this Housing Now initiative, which is really two parts. The first part was to identify the numbers and create the narrative, perhaps even take back the narrative around homelessness. And then the second part is to take that initiative, the numbers that we got, the housing units that we need, and start talking about how do we fund those and get those built. So I want to take you through the deck here. And I'll go through this. I'm going to go through it pretty quickly. And I'm happy to share this email that's out with anybody or to anybody who's interested. Because I'm going to go through it pretty fast. And I really want to open or leave some time, about 5 to 10 minutes for questions. So I'll try to keep this till about 11:20. Again, this is called Housing Now. Part of the reason that this came about too was we kept hearing about the funding coming through ARPA and going to the state, county, and cities, and using those funds to as a catalyst for funding more affordable housing. Certainly, we could look at it as a one-time event, and it's really great that we get this funding in. But unless we find a way to use those funds to create an ongoing funding source or some kind of other ongoing funding source, we're just kind of putting a temporary fix on a larger problem. So the approach that we took on this is, when you have people who are homeless in your cities, in your county, in your state, it really it affects the overall economic health of your community. And so with this investment through ARPA, we felt that this is something that could really help address the economic health, which I think is a message that appeals to a lot of politicians. It's more about it includes the conversation of, look what this, you need to have people who are working in your city. It generates a better place to live for everybody. We also talked about, homelessness is really just a housing crisis. You don't have enough affordable housing for people who are very low income. And tied to that, of course, are the services, which is another part of the conversation. But we all know as a state that focuses on housing first, you've got to have those units in place and then bring in those services. So through partnering with the state, the county, and was really part of the state, the county, and service providers, we're able to get some estimates on the number of units that are needed. So the first year, our current need in Salt Lake Valley is about 3,000 units. And then we estimated 1,386 for the next 3 years. So that comes to just over 7,100 units over 4 years that would be needed for some kind of deeply affordable and permanent supportive housing. We talked about in this middle section, the gold, really focusing on 5 different types: permanent supportive housing, rapid rehousing, purpose-built shared housing, deeply affordable housing, and permanently subsidized housing. I'll take you through the details on that in just a moment. Here we are. So we all know what permanent supportive housing is. It's the deeply affordable with services, oftentimes, most times, for chronically homelessness, for those who are chronically homeless. Rapid rehousing, this is really a short-term rental assistance for getting people quickly moved into housing. Purpose-built shared housing is a way to look at different housing types, but rent geared towards 30 AMI or less. This would include like single room occupancy or other creative housing types. Deeply affordable housing, again, that could be tiny homes, ADUs, but really not a lot of subsidy needed in terms of services, but really just need to have very cheap rents. And then permanently subsidized, these could be apartments and homes, but would also be subsidized through long-term vouchers. So if you look at this little graph, this helps. This is more of a visual of what that is. So you can see with the permanent supportive housing, that really is the long-term rental subsidy and the long-term services. Rapid rehousing is more of a short-term rental subsidy and perhaps short-term services. Purpose-built shared housing would be affordable rent, not necessarily any kind of voucher or subsidy there, but would also or could possibly need short-term services. Deeply affordable housing, no services, just very affordable rents. And then permanently subsidized would be a long-term rental subsidy. So we took these numbers and we kind of tried to break them down into these unit types. And again, we know this is a lot of estimating, but we felt that we had to start putting a message out there. We needed people to see numbers. We need to have people to understand the need. And so again, this changes. We all know how fluid this is, but we did want to start getting this out and start working towards a goal. So that first year of about 3,000 units, the rental assistance or vouchers that are needed would be about 19 million. We would increase case management by 85 case managers, and then that cost would be about 3 million. And we thought that, if you could get Medicare, or excuse me, Medicaid, if you could use Medicaid, you could use about $1 million, $4 million, $5 million to help cover those costs. So we did that for each year. You can see how it goes down, obviously, because the number of units goes down over the next few years. So that's 4 years total. One of the things that we looked at, particularly with the counties, what the county really helped us on this was to say, what are we getting in terms of units, and how many set-asides are we getting, and what does that look like if we were to rely solely on that for the next 4 years? What would we get? Now, we all know that the LIHTC program is probably one of the most, if not the most crucial program in getting deeply affordable housing into our communities. We also know that there are limits. There are a number of we're limited obviously on the number of credits that are available. We are limited on, and there's also, of course, there's other mitigating factors like construction costs, land availability, and things like that. But LIHTC has really been the primary source, and we know that it continues to be the primary source. But how can we add to that? Are there other ways, if we have this funding that could run similarly to LIHTC and provide some of that equity? So looking at these numbers, you can see in the orange, these are the numbers that we mentioned to you with the 2,950 current need and an increase of about 1,386 per year. So that gets you to the 7,108. If we were to solely rely just on the tax credits, or looking at tax credits, and again, this is just kind of some estimates, we're looking at about 4,000 units. And then the light blue line at the bottom is what are those set-asides, what we'd be looking at getting out of set-asides for those over the next 4 years. And you get about 220 units. So obviously you can see that there's a big gap there. And how can we help contribute, or how can we help address that gap? Again, we talk about the county's economic health. Here are some costs that we were looking at. The blue area are the physical units that we would need. So we kind of said, if we could get all these physical units built, what would it cost us? And then if we could go and find existing units, which is the gold yellow section there, what would be the cost to take existing units and make those available? So really the blue and the gold together equal that red column, which is the total amounts of addressing the 7,100 units. If this is fully funded, obviously it provides every single person a housing option. It would free up capacity in the emergency shelter system countywide, which we all know is, I don't know if it's overextended, but obviously under great pressure. It ends a community housing crisis, and it leverages community supports and services. To help our policy makers understand the impacts of getting people into housing, we found some different data points, and we did go out of state on some of these just because we wanted, we know how well it works here, but we also wanted to be able to show that it was working in other places. And so some of this information came from a study done at the University of North Carolina, Charlotte, a housing first study. If you're interested in this, I can forward it to you, just let me know. But in Salt Lake County, we have a 96% success rate on getting people into housing, meaning that they are staying in there. And I can't remember the timeline, maybe somebody's from the state on this. It might be year over year or 3 years, I can't remember, but 96% of the people who are put into housing stay in their housing. There's a 53, these next few, I think, are from the North Carolina study, but a 53% drop in emergency room visits from those who are in housing, 58% reduction in arrests and incarcerations, 35% decrease of mental health symptoms, a 37% reduction of housing first residents using any drugs. And then this last one, we did use Salt Lake County data to show what the savings would be. And it would be with a 58% decrease in incarcerations in Salt Lake County. This would save about $5 million annually in costs. So, excuse me, no, that's not right. I think I need to revisit that, but it's about $11 million in savings each year. So you can really see that this does impact the economic health of our communities. We're spending money on things that could, instead of spending money on these other services, if that money could go into housing, we would really see that social impact. We would really see the result of those funds being used. So we put forth some recommendations. We said we wanted to use the ARPA funding to create a low-income housing fund that would be used to finance this deeply affordable housing. We would require our recommendation would be that any city or county that received American Rescue Plan funding would need to contribute some portion of that to the low-income housing fund. We want to look at incentives for landlords to increase the number of units available out there. That may be through some kind of either rental buy down or some kind of helping with down payments or repairs of units, et cetera. We would want government entities to contribute publicly owned property for the development of low-income housing, which is really, it's happened here a little bit, but it's really something that's happening throughout the country. And we need more of this publicly owned land put up for affordable housing. In my opinion, it's really one of the greatest things that the government can do is by providing that land. Also, we need to access the Medicaid funds for the services and supportive housing case management. And then finally, as I mentioned earlier, really creating this ongoing funding source for low-income housing. And I know there's been, on the commission, we've had several conversations about what that ongoing funding source could look like. Of course, there's a lot of resistance to it because, usually people view it as a tax or an extra fee or something, and that hurts our economy. But really, when you look at the numbers, the amount that you need to collect off of each of these transactions is really pretty small, and yet could generate a lot of revenue. And so hopefully, as a member of the commission, we can get something like that included in a bill this year. Let me just finally come to the commitments here. One of the things that we want to make sure that happens is that people get into housing faster. And I know that sometimes I'm oversimplifying it, but by the time you get your units built and you get them leased, we know there's a lot between point A and point B. But we want to commit to getting people into housing faster and not having these empty units sit out there. If we're getting the funding, they need to be occupied. The service providers, and as part of our conversation here, is also committed to providing better housing results data, which I know has been a frustration of some of our policymakers, in that they don't feel like they're getting the most current or best data, and they want to see the impact of what's going on. And then right-sizing services and supports so that those in housing can succeed. And that obviously would come from additional case management and some funding there. Getting service providers more actively engaged in the communities so there isn't quite the resistance or the NIMBYism. Of course, bringing affordable housing into especially deeply affordable housing or permanent supportive housing tends to make people very nervous. And yet when they're well managed and well designed, we know that they can be successful and actually help a community. And then finally, just be responsible stewards of any funding that comes in through the Housing Now initiative. As part of this discussion, the finance side of this was a kind of a tiered system where it would go through at least 2 to maybe 3 checkpoints to make sure that the funds are being used appropriately and meeting the needs identified in this initiative. So I think I did pretty well, right about 11:20 here. And our feeling on this is that we know that, I mean, everybody on this call knows the need. We see it as we drive around the city or in any city. We've seen how we've seen more encampments. We've seen how homelessness is spread to other communities when the main shelter was shut down. So we see it. And people here on this, I'm assuming everybody here, if not everybody here, knows what it takes. And we also have some really unique opportunities to use some funding to address this issue. So we call it Housing Now because now is the time, and we need to get this done, and we need to improve our communities through getting more housing available and making the lives of those who are experiencing homelessness better and helping them succeed. So let me add just one more thing quickly on the finance side of this. I mentioned to you at the beginning the 2 parts. The second part of this was really creating a model. It's pretty basic. It's very comparable to LIHTC in that you say, well, how much equity is going to need to come in to reduce those rents? And so if we can look at private and some of this ARPA money, how does that come in to reduce those rents? How do we also get the private sector more involved? And is there any way to create some kind of a return to investors if they wanted to come in? And really the only way, and this isn't rocket science, but it's the only way to do that is you've got to have some kind of a mix of incomes in your building that provides some kind of higher rents, and then can be used to help provide some kind of return to our investors. So as we've gone through this financial model, we've really taken that approach of looking at how much. The way it's set up is really incredible. It's just basically like, here's how many units and here are your AMIs. And we can adjust the AMIs. And by adjusting those AMIs, we can see how much of a subsidy or a very patient equity investment and capital contribution or loan contribution to the fund that would be needed to make these projects pencil. And it works. I mean, obviously, the more return you want, the lower the number of units that are deeply affordable will be in there, but there's a balance, and so hopefully through a combination of mixes, we can more significantly address the housing crisis that we're facing. So I'll stop there. I see some questions.
Thank you so much, Mike. I'm sure Tara has some questions. My first question for you will be, I know that, if you do public presentations, people might say, this is a very good proposal, this makes sense. But what's kind of the feedback you have been receiving, I mean, are our leaders willing to do the work to get this done?
Yeah, it's a great question. This was kind of done for two reasons: to get the information in a concise way to our leaders, our policymakers, but also to help move the conversation to a funding level. And I think we've succeeded in the first area in that they've seen this. I've actually kind of been a little surprised on, how do I say this the right way? The lack of, trying to be politically correct here, but not, there hasn't been a very deep curiosity into this. It's kind of like, okay, yeah, this is great. How are we going to do it? Which is maybe fine. Maybe we just need to get to the point of funding it. But it would be good to have questions asked, well, who are these people and where are they currently? And I mean, to me, this is a human crisis, and we need to understand people and their needs. We really need that funding for the services tied into this. So I wish there was a little more, I wish there had been a little more questions, but I think this was actually helpful in creating conversations about now how to fund it.
Yeah.
So Mike, this is Tara. I commend you guys for putting this together. I think it first time I saw it, I'm like, this is genius. I loved how in the past, and we're always kind of reacting to stuff opposed to creating something that others politically can, react to. And, I just think this is just a solid way of talking about the housing for homeless. I do find it, I wish so much we had more of a statewide view on this. And I'm not, complaining to you about that. I'm just saying that we need to find leadership in our other continuas to look at this and project it out as well. And because I think it's important that we don't continue to have the homeless seek Salt Lake County out for housing. And that will continue to happen. I know it's, in the past years ago, they were putting, people on buses to come here. And I know that's not a common practice now. But yet, if we start building this housing, I could see that happening.
Yeah.
So how do we sure that we look at this holistically as a state? And I know we have been discussing it as a coalition and trying to say, okay, this is an incredible blueprint that we need to replicate in the rest of the state. And I just can't thank you enough for putting this together. So my question is, at the tail end of it, you were saying, well, really, how do we get people more engaged in asking those questions? And I'm wondering what the conversation has been with the state, Trish, and with Wayne, Nita Hauser, and others about really having a robust conversation about this with other cabinet members of the governor, because as you indicated, we can't solve housing alone. We need to have healthcare in there and behavioral health and et cetera at the table. So I'm just curious.
Yeah, we presented this to Wayne and Tricia separately, and the financial model. And honestly, I just haven't had time to follow up on it yet. But it was really what Wayne was very encouraged by this. And I think he, like you said, I think it was just good to start seeing some numbers. Again, it's only Salt Lake County, and so you're right. I mean, this is so limited, and maybe even creates more of an issue if you focus all of that funding and attention to one area. This needs to be spread out. I had presented this somewhere, and I don't remember where, and I did get someone from, is it the Weber Continuum of Care?
Well, it would be Balance Estate there, but Weber, their local homeless coordinating council.
That's who it was. I think I got a request there, and they said, "Oh, we want to do this here." So I think it's just it's finding the time and the energy to get it out to everybody. But we have presented it to Wayne and to Tricia as a way to do this. And honestly, I just need to follow up with them and see what else they need to move this. Wayne did present, and Tara, this as well, that at the state commission presented or had a proposal that was recommended by the Housing Commission to use $100 million of the ARPA money to go towards deeply affordable housing, so 40% and below. And I don't know where we are on that. We haven't had a discussion about that since, and our last meeting was canceled, so I'm not sure where we are, but happy to bring that up and see what's going on. There was a second motion on another 100 million from Dave Spatafor. That's for housing at 60% AMI, which is fine, but I do feel like we've kind of focused on that area in the past as the commission, and it really would be better if we could now start focusing on that deeply affordable. If these funds are available, let's make sure they get to where some of the greatest need is.
So, Mike, one of the things that I felt was incredible, that when Wayne was, discussing the $100 million, how many times he talked about case management.
Mm-hmm.
And I swear we could probably, if we had $10 for every time he said that, we could probably fund a year of it, because he really, really was pushing that. And he's so right. We need to have the right type of case management there. We've been talking about that for a long time, and I'm so glad that he realizes that that is key. Also, I wanted to bring it back to what you just said, and I can't remember what you just said because I saw Dan Adams' long thing came up on the thing. Hi, Dan. So yeah, I'm just so happy that this is happening, and that hopefully, one of the things that Wayne had indicated when we were chatting, he goes, we just need to get these silos together. And I'm just so excited that he is at the table and able to make that happen. So anything the coalition can do to help move this forward, I think would be great.
Can I just add one thing? I know I'm out of time here, but in response to Dan's question here or comment, which ties into what you were just saying, and Tara, you know the other half of this much better than I do, but on the commission level, my frustration has been that we have focused on this higher AMI. We keep putting money towards the preservation fund, which is great. We know we need housing preserved. We have not seen the funding go towards deeply affordable housing that is needed. We have just not seen that. In this commission, we're in our third, I think, are we in our third session now? We're approaching our third session as a commission, and we haven't seen it. And that's very frustrating. I know to several of us on the commission that even though in our first meetings this year after last session, we prioritized what we wanted to focus on this year, I don't feel like we've even addressed it yet. And we're trying to bring up those discussions back to this. Like, how are we getting this funding out? How do we take what Wayne's proposal is and actually implement it? And so we've had some kind of conversations, some of us offline, just saying, look, we got to this is where the focus needs to be. Preservation is great. We continue to need that. But if that's all we're doing, we're not going to really address this need. I think, on the other hand, like I mentioned earlier, or just a minute ago, Terry, you would understand much better than I do the legislator side. Like, what are they talking about? That 100 million that Wayne proposed, is there really, is there, I don't say backbone, but maybe that's what it is. Is there a backbone in the legislature to take that 100 million and really put it towards deeply affordable? So I'll tell you what I know from the commission side. I don't know what will happen in the actual session.
Well, I think you're absolutely right. We haven't, we continue to do the easy stuff. I mean, 60% of AMI is something that you can already pencil in some degree when it comes to mixed use. So how do we drill down to the units that we need? Because, somebody making $12, $13, $14, $15 an hour cannot afford to live in their community. And most people are working that need help. And so I think it's all of our job on this chat right now to reach out to our legislators and talk about how important it is for housing that people can afford, whether it is through, our school systems or healthcare. I mean, we have so many, housing is so much. It is the foundation. And so how do we make sure that we build that infrastructure to make that happen? So thank you, Mike, so much.
Yeah.
And
thank you.
we have a lot of members out there that I know would definitely support this.
Great. Thanks.
Thank you, Mike. And Mike, there are some kind of comments, questions in the chat. If you have the time to respond them, one comment from Camille is that the problem is developers cannot build. It's just they cannot put a project together to provide housing for people that make less than 30% of AMI. And what we need for those kind of projects, it's project-based, it's voucher-based rental assistance. That's what they need, because they just cannot build, and I completely understand the problem. So with that being said, Mike, thank you so much again. And you know, anyone who has more questions, please reach out to Mike. I'm going to put his email in the chat. But I would like to invite Katie now from Unite Us to do her presentation. And Katie, you have the mic. You're on. And you can share your screen.
Okay. Can y'all hear me okay? Can I get a thumbs up?
Yes.
Okay. And you can see my screen. Fabulous. Okay. Hi, everybody. Thank you for having me. I don't know if I've met many of you. I was trying to look through the participants, and I don't think that I've met very many of you. So hi, and thank you for having me, to Tara and Francesca. My name is Katie Prawitt, and I work with Unite Us, and I am going to give an overview of Unite Us and the work that we are doing, and also a quick demo of our software. You can go ahead and post any questions that you have into the chat. I don't know if you have options to unmute yourself. I'd be okay with that as well. But what we are talking about today is a new model of care for the social service sector that is driven by the community. Prior to Unite Us, I worked at Salt Lake County Health Department. And as I was engaging in some work there with community organizations and community members, I just remember so many different times when somebody needed a resource, whether that was for housing, or whether it was for some food resources. And I would be able to give them a name of an organization and had no clue whatever happened to them after. And so that is what Unite Us is here to solve. And that's why I made the jump over to Unite Us, is because we have a technology platform that is free of cost for nonprofits that allows you all to do care coordination with your clients in mind. So typically in our before, we see that organizations will help facilitate a referral for a client, and then they don't know what happens after unless they're following up actively with that client or following up actively with that organization, which can be really time consuming. And so with the Unite Us platform, it allows organizations to actively collaborate across sectors and all have visibility into a client's journey at some organizations that they are working with. So I want to give a couple examples of how we've had some organizations across the United States utilize this, but I do want to add that Intermountain Healthcare was our very first customer here in Utah, and that is how we have been able to keep this service free for all nonprofits, and that is always going to be our business model, that we're able to keep it free, and our government, healthcare, etc. partners all pay to have licenses, which helps keep it free for all of our nonprofit partners, which is really lucky. So on that note, I want to give an example of a Kentucky housing agency that received 145 referrals within the platform, over 1,000 assistance requests, which is an individual asking for assistance through a form that we input onto their website, and also opened up 58 internal cases. So that could be just somebody walking into their organization and they decided to help them. They were just inside of their organization, able to resolve 81% of their rental or mortgage payment assistance, 60% of their housing mediation and eviction prevention. And then with those same clients, they sent on a bunch of different referrals that helped them meet 87% of their food needs, 72% of those utility payment needs, and 75% of their legal needs were able to be resolved. Now, they probably were already going to do these referrals for this client, but now they have data to back up that they're not just a housing organization. They're a community hub that's helping people get connected to resources outside of their organization and really following up on that social determinants of health and full person-centered care. So just a little snapshot of the data that's accessible to our partners that join the network. So you'll see on the right-hand side, those are my little snapshots. And what those are is our Insight Center. So I'm not going to do a demo of the data today. I'm going to do a demo of the actual platform, but just know that anything that is inputted into the platform is exportable out of the platform. But we also have this beautiful Insight Center that provides these graphs and all of this data already for you, which is great for tracking your organizational activity, measuring impact through data. You can show, again, like that Kentucky Housing Agency, that they're not just a housing organization, they're also a community hub that's connecting all of these individuals to so many different resources in the community. And then we also have people at my organization at Unite Us, a policy director for each region, and they're going to be looking at this data to be able to, again, like you were talking about during the beginning of your conversation today, about those legislative decisions and where can we make new investments if we see, and actually currently the highest need within our current network here in Utah is housing and dental services. So what do we need to do as a community, as a legislature, to help figure out how we make that a more accessible thing for people within our nonprofit and social service community. So before I jump into the platform, please go ahead and submit any questions you have into the chat. But I do want to talk about client privacy because I do understand that that's going to be a priority for a lot of organizations, and that is a priority at Unite Us. We have several ways that we protect clients' information, but I want to highlight a few here. We never share client data without consent from the client. They do have to provide their own consent. Consent process is offered in 6 different ways in over 50 different languages at a 5th grade reading level. We also protect clients' most sensitive information. So for example, if you're working with a client at your housing organization and they're also working with a domestic violence organization, you would not be able to see, you would not have visibility into their case over at the domestic violence organization because that is very sensitive information that we keep protected. So substance use providers, domestic violence, legal services are automatically classified as sensitive. And then lastly, our platform is HIPPA compliant and high trust certified. We follow the highest security frameworks in the industry, including 42 CFR Part 2 and FERPA. Okay, if I don't have any questions, which I haven't seen any come through, I'm going to go ahead and hop into my platform. I'm going to refresh my page here. So something just to call out, the reason I refresh my page is a security feature that we do have is it logs you out every 15 minutes if you're not actively using the platform, which is just so that you don't like walk away from your desk for lunch and have client data up on the screen. Also, we have an email and password for every single person that joins the Unite Us network. You can log into Unite Us from uniteus.com. You can log in right here, type in an email and a password. And then also a good call out here is that you always have access to the support center. They're open Monday through Friday, 6 a.m. to 9 p.m. So pretty accessible for our organizations. They're a little bit more accessible to me because I'm out doing presentations and onboarding organizations and doing training. Whereas if you're utilizing the network on a daily basis, they're going to be much more accessible. As soon as you log into the platform, what you're going to see is this. You would have your own name up here, and you would be able to see the organization that you're working with that you're logged in as. You can see incoming cases to your organization, and also you can see referrals in review. When you get an incoming referral, you have options to accept, reject, mark it as in review, and I'll show you what that looks like in a moment. Below that, you'll also see a timeline, which is set up kind of like a social media feed. And so today I'm going to show you how to send on a referral for a client I'll show you how to take action on that referral and also just show a couple other features that are really nice within the platform. So to send a referral, I'm going to go ahead and select this plus button and hit new referral. And I can go ahead and put in a name, and I'm going to do Brittany Goodman and then give a birth date here. And it's going to search our records and pull up anything with a similar name or date of birth. Looks like I have a couple Brittany Goodmans and a Steve and Amanda Goodman, but they don't have my same date of birth or they don't live in Utah. So I'm going to go ahead and create a new client here. This is where I'm going to input some demographic information for the client, although the only thing that's required is first name, last name, and date of birth. I can leave all of these as undisclosed if I'd like to, but we do know it's important information to capture if we're able, because we do have a health equity dashboard that's nice to look at and see where we're missing the mark within our network here. Contact information is also important information to capture. I'm going to put in my own phone number today to show you a feature that works out really nicely. I'm going to consent my phone number to receiving text messages and also notifications on my case. So when a referral is like accepted at another organization, it'll send me a notification that it's been accepted. I'm going to leave my address blank today to save us some time, but I'm going to include a zip code because it's going to pull up services in that area. And I'm going to click Save Client. This is what it's going to ask me about service types. And I have over 150 different service types available. No matter which service type I select, one organization will be consistent across all of the different service types, and that's our coordination center. So Unite Us partners with United Way, 211 of Salt Lake, and they actually run our coordination center. So if I click life coaching, for example, they're always going to show up here as the coordination center, and that coordination center will always be an option if you maybe don't have time to look for the best fit organization, or you don't, or there isn't a good fit for your client. The coordination center will then take that referral, and then they will find the best fit provider and get your client connected to that service. So today I'm going to send on a referral for clothing for my client. And I am going to look at these. I've got the coordination center or RentASwag. Well, if I don't know much about RentASwag, I can go into this browse map feature, click into their profile and read up on the organization here. I can see that they do gently use clothing and provide clothing for job interviews. That sounds like a good fit. I can see the eligibility requirements here and also which languages they speak at their organization. So I can add them as my organization if I'd like. You also can filter if maybe a client really struggles with transportation. You could try and find an organization that's maybe within 5 miles of the client address or within 10 miles of the client address, for example. I'm going to add the recipient as RentASwag to this referral, but just wanted to show those options for filtering. So I'm going to say client is looking for clothing for an upcoming job interview. Okay, you can add as many referrals on as a client needs. Typically, we see that folks that need some social services typically have more than one referral that they need to be sent on for them. So I can go ahead and hit next here. It's going to ask for some supporting information. I am going to skip through it, but it's just going to ask like who's in need of clothing, what's the purpose, what type of assistance. And then from here, I'm going to review it. And if everything looks good, I can submit. And this is when it's going to ask for that consent. And again, it's offered 6 different ways. I have options to do an audio file. I can upload a signed paper form. This is downloadable in 50 different languages. I can do on-screen consent, email, text message, or verbal consent. So I can go ahead and sign on their behalf after I've read this to them and said, do you provide your consent? Do you understand with what I've read? Did you have a chance to ask questions? Do you have any other questions? And if they answer yes, 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 no, I will sign on their behalf as 1111 that they gave their consent for their information to be shared to get them connected to a social service. So it's easy as that as far as sending a referral on for a client. Now I'm going to hop over to RentASwag's profile and show you what it looks like to take action on that on Brittany Goodman, and then also show you that client profile and the My Networks tab. So just a couple more things I want to show just to give a little snapshot of the Unite Us network. So I have now hopped over, transferred my screen. I'm now RentASwag. I'm going to refresh my page and hope that I didn't get logged out. Okay, I didn't. Okay, so I'm logged in as RentASwag now, and you can see that that referral has come through. So it is pretty immediate. So I've got that clothing and household goods referral was created for Brittany Goodman by 11/11. Here's the date and time. And I can see that I have 8 incoming referrals at my organization. I can get to my new referrals by going to the dashboard or clicking on this number 8. Anything in red means it needs my action. So I can see that it was sent by the Upside Down Federally Qualified Health Center, and they need clothing and household goods. So I'm going to click into this referral, and I can see that referral description here that the client is looking for clothing for an upcoming job interview. I can see some very basic information on the client, but I cannot see who else the client's working with. I can't send a text message. I can't do anything with the client until I've accepted them and said that I have capacity to serve them. So my actions that I can take here, I could send this referral to another organization. Maybe I don't have capacity, but I know my neighbors down the street could help. I can reject a referral. It's always going to ask for the reason. So maybe they're not eligible for our services. We don't have capacity. We couldn't contact them, etc. Or you can accept a referral. So let's say I'm going to accept this referral for RentASwag, and I'm going to assign it to myself, Tom. And this is the point where my workflow is going to probably turn back to normal, where I'm going to call this client, Brittany Goodman, and I'm going to call Brittany and say, hey, Brittany, I have some clothes for you. What sizes do you need? Okay, I'll set those aside. Why don't you come in tomorrow at 10? At that point, I would have the option to resolve and say that the client received clothing and add a note, client received 2 pairs of pants, 2 bras, and a pair of underwear. And then you can close that case out. So that's kind of when it returns to normal for you. Now, I do want to show you that now that I've accepted this referral, it's turned into a case. And now I have access to Brittany's record within the Unite Us platform. This is where I could send a text message to Brittany and say, reminder of your clothing appointment tomorrow at 2 p.m. I can send that. It's going to immediately come to my phone here. I just received it, and it says you have a message from RentASwag, reminder of your clothing appointment tomorrow at 2 p.m. So that's a really great feature for organizations that need to quickly send something over to their client, but don't want to do bi-directional communication or don't want to use a personal phone. That's really nice. You can add care team members here. You can see what other referrals this client has at other organizations. You can see that they've been accepted or they're closed. So that's really great information to have. You can upload documents for a client. And then also one thing, I don't think I showed this to your team over at Utah Housing Coalition, but you can do a screening for a client, which is a really cool way. This is a social determinants of health screening. It's a great way to find out what needs this client has. So if I say yes to any of these questions and I submit, I'm going to skip the others. It's going to say, here are the things that we think that you could use a referral for. And if I'm like, they don't need school meals or Snapper WIC or prepared meals, then it can create a direct referral from that client profile. So you can do that social determinants of health screening at your organization to determine what needs that client could have outside of what you're providing them. Now, the last thing I want to show is the My Networks tab here. So the My Networks tab is just going to show you all of the organizations. This is outside of sending a referral. This is just how many organizations are using the platform, what types of organizations are using a platform. I can tell you that currently, I'll show you a map of where we're live, but we do have over 180 different organizations currently utilizing the Unite Us network across the state. And if you wanted to see who was here, you could go ahead and say, I want to see who provides immigration services. Now, let's say you have a client who's like, I don't want you to send my information, but I want you to tell me more about that resource. You could say, okay, well, I'm going to go into this client profile and share this by text, email, or print to a client. Now, if I go to print it, it does print off very nicely. It's going to show you the location and give you the whole organization profile. So this is kind of the directory portion of our services. You also have access to all the different users. So if you wanted to know who works at the refugee center because you wanted to get in contact with one of them, this would be a great way to be able to network within your community of nonprofit providers. So with that said, organizations are also able to turn on and off referrals. I'm not sure if I mentioned that already, just wanted to call that out. Also, each user within the platform can have their own user settings. So we'll have like an organization administrator. Each user will then be set up separately to whatever needs that you have at your organization. You also can set up your notification preferences. So with that, I'm going to come back to my map here. You'll see all this dark blue is where we are currently live. So we're currently live in Salt Lake County. This medium blue is going live in December. And then also going live at the beginning of 2022 is this light blue. Now, I would love to open it up for questions or thoughts and see if anybody wants to reach out. I'll keep my information up on the screen, but wondering if anybody has any questions that I can address now.
So thank you so much. Quick question. Thank you so much for the presentation. How many organizations from Utah you already have in the system, in the network?
We have 180 organizations currently utilizing Unite Us. We're growing really, really fast actually right now. Grand County just had, I think, another like 10 organizations just join. So we're growing pretty quickly right now. So I'm sure that will change by the end of the year because we do have a launch. Like I mentioned in these areas, these light blue, they're going live in about 4.5 weeks. So we'll probably jump quite a bit at that point. So that's exciting. But again, we always like to ask organizations that join the network, who would you like to see on the network? How can this be made useful for your organization? So that's how we grow, is kind of that organic growth by like, who do you want to see? Who would be nice for you to send referrals to at your organization?
So Tara has a question for you.
Okay.
Well, actually, you have 180 partners already in Salt Lake.
Not in Salt Lake, across the
not
state.
In Salt Lake, across the state. I mean, okay, that's cool. Because my question was just about that: is what if clients are using a different platform? Because it seems like, because I reached out to the state after we chatted to find out, if they were looking or if they whatever. And she said that there's been so many people that have approached the state on this particular type of software.
Mm-hmm.
And so I guess my question is, what happens if the state picks a different one and you guys are doing this work? Does that make sense?
Yes, no, that's a great question. And basically the answer is Unite Us is not planning on going anywhere. We do have a customer here in Utah, so we will continue to build our network regardless. Typically what we see, so one thing that is interesting about Unite Us is that we are going to be the more expensive choice, but we have a lot more options for outcomes. Whereas a lot of our competitors in the industry don't track outcomes. So people will typically see like, oh, we're going to go with this cheaper option. And then we see that contract end. And then typically people will pick up Unite Us because there's a lot more options with data. As I was talking about a little bit earlier. So our data features are really robust, and our outcomes, I think, is for me, the most important thing is the outcomes, because it's really nice to be able to know what happened to that referral or that person that you sent on to another organization. So I appreciate you asking that.
So follow-up question. So is
Mhm.
there a place where like case managers could share client notes?
Yes. So right in that client face sheet, if you're in here, you're able to see all of the different notes. You can just add, like, if I wanted to add a note right here, if I just want to add a general note, it's going to post it to that client timeline, or I can attach it to one of these cases here.
Okay. Well, I guess my only concern after speaking with the state was that you guys are really far down the road, and you're right, you do have a client, but yet if the state walks in and wants to pick up something, I'm just trying to figure it out, because the state, because they give these agencies funding, they're going to ask them to be using their platform. And so it's, I guess what I'm trying to say is that some nonprofits don't have the capability to do multiple. And so I just hope that that we don't have to have multiple systems. And so coordinating with the state would be really cool. And you said you had a meeting with the health department coming up?
Yes, and we are actively talking to the state. But that's like a sales conversation kind of outside of my wheelhouse, because I focus on the nonprofit side of things. But we do have active conversations going on with the state, because our partners at Intermountain Healthcare obviously are involved in those conversations as well, because they're very actively interested in a software that helps address social determinants of health. But I definitely, trust me, I understand that it is scary that if they went with another software, I'm like, what happens to my job? So I feel you on that, and definitely can understand why that would be scary. But we are in active conversation with the state and with all of the government agencies across the state.
Okay. Okay, great. Because I heard that they were looking at something else.
Mm-hmm.
And so I just want to protect our members, from having to go through this, in terms of, because I think this is a great product. I think it's really helpful. It's, incredible platform. And I just hope that, we get the tools that are needed to help our clients.
Right.
And I say but our community members.
The not wanting to start with one and then jump to another. I totally understand that. And I just received a question. Yes, Camille, we are in contact. I think that they had a call either today or next week with Utah Department of Health and Human Services. And then as far as HEMIS goes, I sent a flyer over to Tara and Francesca around folks utilizing Unite Us alongside HEMIS. We are in conversation with the the technology behind HEMIS and how we can integrate our systems together, because Unite Us does have integrations with EHR systems where it's a single sign-on and you can access Unite Us from within your EHR. But again, that costs money. But I can send out some additional flyers and information regarding Unite Us if anybody is interested in having some follow-up conversation, seeing who's on board. I am happy to facilitate those conversations offline. Currently, we have 2 housing authorities. We've got Davis County and Salt Lake County. I think just 2. I would have to look back at my list. Privacy issues, Dan, as I mentioned, we are HIPAA compliant, aligned with the strictest federal privacy guidelines, including 42 CFR Part 2 and FERPA. Would be happy to send over some additional security information if you would like it.
So I have another question. So have you ever used has in other states had management companies join this platform? And I say that because we do have I'm sure any management company may have found that their resident needs a referral somewhere, or and I just think that as we move forward and we get more trauma informed, management companies, that this may be a really helpful, besides just people that have been normally working with, like a housing authority. Does that make sense?
Do you mean like a property management company?
Correct.
I don't know for sure if that has been utilized in other states. I will just add on that note, we are a little bit more robust in across the East Coast. Obviously, it's a little bit more liberal out that direction, and forward thinking. So we're excited to be here in Utah in general. But I would love to find out more from my partners in other states if that has been a thing, because I love that idea, Tara. I'm glad you brought that.
I really like that idea too. And if you could look that up, I think that would be really helpful.
Yeah.
Especially for people that are just feeling, I want to help this person out, but I don't know where to send them. And they've been a great client for, resident for 2 years now, and they just have some hiccups. So
issues. Yeah, absolutely.
Perfect. Thank you.
Okay.
Well, thank you everyone for participating in this meeting. I'm gonna, Katie, if you like to stop sharing your screen, I'll appreciate it. I'm gonna send some information to all of the people that registered, because not everybody attended today. And I'd like to thank Mike and Katie and everybody else who attended. Have a wonderful day, everyone.